Beautiful. All right. So hi, everyone. Welcome to this webinar on pain and arthritis. My name's Bree. I'm the Health Promotion Coordinator for Arthritis Queensland. And as mentioned, today's webinar, we'll be discussing pain and arthritis. And as we know, pain is a very complex and individual experience, and it varies so much among everyone with arthritis. So I've done my best to explain what pain is and how it may be experienced by you and the different ways that might help you manage your pain, but I'm definitely no expert when it comes to pain. Oh, can you hear me?
Yes.
Oh, I just got a little thing up saying that I was muted. So it's a bit...
No, you went for a while.
Yeah, that's strange.
Okay, I'll mute it back again now.
That's good. Thank you. So as I was saying, I'm definitely no expert when it comes to pain and explaining what it is and how people may experience it. However, we do actually have an expert guest speaker presenting in the next webinar. So that's on July the 27th at the same time in the morning. And it's on cognitive behavioural therapy. So it'll be really great to register and tune into that one as well. So also, I'd like to mention that I might get kicked out of Zoom at some stage. So the last webinar I presented, Zoom kicked me out halfway through, and it actually did the same thing to me yesterday when I tuned in for that webinar on CBD. So if it does happen, for some reason it does kick me out, please bear with me. I'll only be gone for like a minute or two as I'll be re-logging back in. So sorry if it does happen. I don't know why Zoom's doing that. Okay. So this presentation contains general information and advice. We've done our best to ensure that it's accurate and reliable, and it's not a substitute for individual treatment advice from your doctor or your health professional. Make sure you always have a chat to your GP or specialist to provide individual medical or treatment advice. In the spirit of reconciliation, Arthritis Queensland and Arthritis New South Wales acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So today's session will be is focused on pain education. So what is pain, which is one part of pain management. So in previous webinars, we've covered exercise and how it can be a fantastic way to manage pain. And then in later webinars, we'll also look at cognitive behavioural therapies, sleep and mindfulness, and we will have some expert guest speakers. So as I've mentioned, make sure you register and tune in for those ones, as the advice is going to be extremely valuable. But the topics that we are covering today are what is pain, focusing on identifying what acute and chronic persistent pain means, how pain works, arthritis and pain management. So what are the different types of pain? So the first one is acute pain, and acute pain is short-term and tends to be more associated with tissue damage or possible damage to your body. So for example, if you sprain your ankle, it is likely that you'll feel pain associated with the bruising and swelling. So this is acute pain. Usually it will settle as your body heals because the affected part no longer needs protecting, and healing usually takes less than 3 months, even for quite severe injuries. And the other type of pain is chronic, or also known as persistent pain. For this webinar, we'll be calling it persistent pain. So this type of pain lasts longer than acute pain and often does not indicate ongoing damage, even though it may feel like it. In the past, we assumed that this was because we had not healed after an injury, but for most people, we now know that it is unlikely. Instead, the pain is less to do with the injury in our bodies and more to do with our central nervous system. So pain is said to be chronic if it persists beyond the normal healing time of about 3 months. Persistent or chronic simply means ongoing and doesn't tell us much about the severity or quality of the pain. So many people are new to the notion of persistent pain because they are taught that pain goes away when tissues heal after an injury or illness. However, this is not the case for 1 in 5 Australians, as pain may not lessen when the healing process is complete. So, pain as a volume dial. It's like the volume knob or dial on our pain system has been turned up to full volume, just like a radio stuck on loud or max. It's really important to understand that you can turn the volume down again, but it often takes effort and time. It won't happen by itself, and you need to be patient in working towards it. So this is what we'll unpack as we move through the presentation today. But first, let's briefly look at how pain works. So let's have a chat about how pain works in our bodies. So the first point is that the nerves and brain interact. So it may seem strange, but pain can be a good thing. When you first injure yourself, acute pain can help you change what you're doing so you can avoid further damage. So without acute pain, a person may keep running on an injured ankle or keep opening up a healing wound. When we injure ourselves, for example, stub our toe, our nerves carry lots of information to the brain to make it take notice. In our body, there are millions of nerves and they are constantly interacting with one another. It's just not a one-way street. Signals go up and down all the time, and there's a real buzz of chatter in every direction. And the second point is that the brain produces pain. So the brain is really important when it comes to understanding pain. It may surprise you to learn that all pain, no matter where or how it is felt, is produced by the brain. So when you injure yourself, the nerves in your body can only tell your brain that something has happened. It is your brain and not your toe that interprets this and says to you, hey, this hurts. So before your brain tells you you're in pain, it must first combine a heap of information and then try to make a sensible interpretation of it all. So your nerves just say to your brain, danger, something is happening to your toe. Your brain then weighs up many aspects of your immediate environment, as well as other life factors, such as what you do for your job, your personal or cultural beliefs, whether you injured your toe in the past or what you're planning to do in the future. Only after sorting all through all of this, it will tell you whether or not your toe hurts. It does this incredibly quickly and well before we're aware of anything. And the third point is that nerves can get sensitive. So when a person first hurts themselves, it's normal to experience soreness, both near the area of injury, in other areas around the actual injury site. So for example, after stubbing your toe, you may feel pain spreading all over the rest of your foot or even up your calf, well beyond any areas that were damaged. So in this scenario, the volume around that area is temporarily turned up. This is absolutely normal and helpful at first. This increased pain can remind us to slow down and avoid doing more injury as we heal. And usually, this pain settles back down rapidly as we get back to normal habits and activities. And in some situations, pain can hang around for longer than it's helpful. And remember, this is what we call persistent pain. And it is often related to that extra sensitivity. The buzz of chatter among our nervous system starts to set up and reinforcing these feedback loops. So in the chat box, can you please write your answer? So true or false, pain always equals tissue damage. What do you all think? And we'll also go through, we'll explain the answer in the upcoming slides. Yeah, so it looks like everybody is onto it. That is correct. It is false. So why does pain remain? So the first point is that our pain volume dial remains turned up. It often feels like persistent pain is due to that ongoing or recurrent damage to your body. However, pain that remains after the 3 months often has more to do with changes in the nervous system. The original injury will have healed as much as it can, and although you may be still getting some signals from stiff joints or poor muscle control, the biggest problem is often that increased volume. So your nervous system becomes more sensitive, hypervigilant, and wants to protect at all costs. And the second point is that our nervous system becomes hypervigilant. So while persistent pain may feel like a lot like acute pain, it tends to act differently. So what happens is that your nervous system responds to normal messages such as touch or cold or movement as if they're really dangerous. So that volume dial stays turned up long after the injury has healed. Even a little bit of information input can lead to a lot of pain. So something that might not have hurt starts to, or something that might have hurt just a bit or starts to hurt a lot. And these are signs that the problem is changing one from a physical injury to one of a turned up nervous system. And the third point is that there might be a change in the brain where unhelpful neural patterns are formed. So when our nervous system becomes sensitized, it's common to experience pain with everyday movements such as walking, bending, or twisting. In some cases, even just thinking about a particular movement or activity can trigger pain. So why does this happen and what causes these changes? So when a person repeats a particular movement or activity on a regular basis, the brain creates a pattern of nerve connections. So if a movement is painful for long enough, the brain will really strengthen that connection between that movement and that pain feeling. It's like your brain has joined the dots between, say, the normal sensations coming from your back, the movement of bending, and the memory of injury and then experiencing pain. So this unhelpful pattern can become sensitized or turned up. So once it's sensitized, just even preparing to do that movement may be enough to cause that pattern to kick in and for you to feel pain. The body has healed as much as it's going to, but the movement still hurts. All right, true or false? So in the chat box again, please. Is it true? Can emotional stress cause or influence our pain experience? So true or false? Absolutely, everyone is onto it, and it is true, and we'll go through why that is. So we'll discuss the psychosocial model and what that means. So every system that keeps our bodies running can get involved in producing and responding to pain. So the way a person experiences pain is influenced by a lot of factors. So we are social, spiritual, physical, and mental beings. And persistent pain is a whole of life problem. So effective management needs to take a whole of life approach. So to put it simply, the way we experience pain is highly influenced by our overall well-being. So most of us can recognize stressful or emotional situations that have affected our pain. It might have been tiredness, following too little sleep, or an argument with our partner or kids or loved one, a really rough day at work, or anxiety about paying overdue bills, or sadness, anxiety of what's being portrayed in the media, or grief over a death of a loved one. So our thoughts, beliefs, and our environment can make us susceptible to a turned up nervous system and therefore more prone to persistent pain. Although we know clearly our pain is not a conscious decision, we also know that our conscious decisions and actions can make a huge impact on our pain. So research points to a number of factors that influence persistent pain, and it could be how scared or how stressed or worried a person is at that time of injury, what that injury means to someone, and what they believe has happened to them, how long a person avoids their normal activities, and also their family history. So In other words, our personal beliefs and environmental factors can make a really, really big difference to how we experience pain and how likely it is that that pain will persist. So now we're going to discuss how our emotions may affect our pain levels. So interestingly, the natural chemicals that occur and are released in our brain are connected with tiredness, stress, anxiety, or depression, and are very similar to the chemicals used to communicate danger or damage. In a sensitized, so that turned up nervous system state, the chemicals released by low moods and associated feelings can really turn up that volume of our pain dial even more and make our pain worse. So other factors like a rundown immune system, avoiding activity and friends, having weak muscles or poor sleep, scared of pain and moving, and overwhelmed by life stresses can really increase our pain volume. And these are what we call DIMs. So that stands for dangers in me. And these can be negative things that identify as pain triggers. So for me, it's my moods, it's my feelings and my thoughts that are my DIM, and they can really cause and trigger just as much pain as something physical. Thankfully, it does work the other way as well. So the natural chemicals associated with happiness or fun times or satisfaction turn the volume down in our pain dial. So these factors can be related around seeing your family and friends, managing life stressors, making plans, having normal activity and movement, and having strong muscles and sleeping better. So this is a powerful system which some people have linked it to a medicine cabinet in the brain. So by doing things that are enjoyable and meaningful, you can really start to harness these feelings. And these are what we call SIMs. So that stands for safety in me. And they're all those positive things. So where does persistent pain stand with arthritis? So arthritis is likely a mixed pain state, and people with arthritis can feel acute pain due to tissue damage and that general disease process. So for example, there may be an irritation or pain in someone's back, knees or hips when they go from a stand to a seated position. And with this, the synovial fluid hasn't had the chance to move around or lubricate the joints. Or that person could be experiencing a flare-up from their inflammatory arthritis. So these are examples of acute pain in arthritis. The most common persistent pain mechanism in arthritis is that the volume dial is turned up at the site of damage. But there are other mechanisms that result in pain as well. So for inflammatory arthritis, it's those flare-ups that cause that immense pain. And this is when your immune system attacks healthy tissue and causes that pain and inflammation. In osteoarthritis, there may not necessarily be damaged tissues like inflammatory arthritis, but the inflammatory markers have been found in synovial fluid of joints with osteoarthritis, and this can cause the micro damage, which causes pain. Also, swelling can be a trigger, as well as deformity and altered gaits. They can all trigger pain as well. And we spoke about how our brain may make new neural pathways or changes in our brain, and these can contribute to the mechanism of persistent pain. So for example, other symptoms or conditions that would not be explained by a purely peripheral or tissue problems are often seen. So for instance, you've got fatigue, insomnia, and multifocal pain in areas not commonly affected by arthritis. So due to the changes in the brain made by persistent pain, it's not uncommon to see the following comorbidities. So these could include anxiety, depression, sleep disturbances, lowered self-esteem, anger, loss of confidence, and catastrophizing. And I'm sorry, I probably won't pronounce this correctly, but kinesiophobia. Sorry, it's a bit difficult. So these are all referred to as a negative affective states. So what we mean when we say catastrophizing is that it involves irrational thoughts where we believe something is far worse than what it actually is. So this can include present or future events, and it coincides with rumination, where these thoughts go round and round in our head and we can't stop thinking about them and we like solely focus on them. Kinesiophobia is a fear of movement. So a lot of doctors and specialists see patients that have this excessive, irrational and debilitating fear of physical movement and activity, which is resulting from that feeling of vulnerability to painful injury or a re-injury. Kinesiophobia results from the misinterpretation of painful bodily sensations as a sign of serious injury. And consequently, individuals might tend to avoid pain-related movements driven by this emotion of fear, which increases disuse and disability. I would like to mention sleep disturbances and how various studies found that patients experience persistent pain do in fact experience significant sleep disturbances. So this raises several questions concerning relationships among persistent pain, sleep disturbance, and mental health conditions such as depression and anxiety. So other studies identified increased pain sensitivity is associated with greater sleep disturbance as well. So it seems that a lack of or poor quality sleep interferes with our ability to cope with our pain. So now we're going to go on to discuss some different ways that you might want to manage pain. So first thing that might be helpful is to start regularly monitoring your pain. And this can be done using a pain diary and a visual analog scale, which you can see the picture on the slide. And they are valuable tools for people with arthritis in managing their pain effectively. So a pain diary is a written record where you can document your daily experiences with pain. So you can track and monitor your pain levels, patterns, and triggers over time. And by consistently recording this information, such as the intensity of pain, activities that may worsen or help with your pain, and the effectiveness of pain management strategies, you can gain a lot of insight into managing your condition. So this information can be really helpful to provide to your healthcare team, and they can have a better understanding of the nature of your pain and make informed treatment decisions. So this visual analog scale, it's a simple tool which is commonly used to measure pain intensity. So it has that straight line with no pain down the end and worst pain imaginable at the other end. So people just mark on the point on that line that represents their pain intensity at that particular moment. So the distance from no pain endpoint to the marked point is measured to determine pain intensity. So by using a pain diary and that visual analog scale together, you can gather comprehensive information about your pain experience. So they offer several benefits for people with arthritis. So it helps increase self-awareness, and this allows you to pay attention to your pain levels and how your pain may fluctuate throughout the day. So this self-awareness can help identify patterns, triggers, and potential factors that worsen or alleviate the pain. The second point is that it's really helpful to provide communication with your healthcare providers, as it's detailed information that's recorded in your pain diary, and you can share it to your healthcare team during appointments. It provides them with that clearer understanding of your pain experience and facilitating more accurate diagnoses and treatment recommendations. It's really good for treatment evaluation, as it tracks your pain levels and the effectiveness of the pain management strategies in your pain diary. So you can assess which approaches work best for you. And then this information helps identify effective treatments and then make informed decisions about pain management. And the last point, it also helps with empowerment. So the act of actual documenting pain and utilising pain assessment tools can empower people with arthritis to take an active role in managing their condition. So it can help them make informed choices regarding lifestyle modifications and treatment options. So having knowledge and information on ways to manage and understand your pain can improve self-management and help you have a deeper understanding of your pain and arthritis. So one way that people have found to be helpful is to address and change negative or unhelpful thinking patterns that contribute to emotional distress or difficulties in coping with challenging situations. So some examples of this may be catastrophizing and repeating thinking on negative feelings. And this has been seen to increase that risk of pain being long-lasting or persistent. The second point is that fearful anticipation of pain. So this seems to pre-activate the brain regions involved in both the sensory and emotional intensity of pain and primes a stronger initial pain response. So that means that it can increase the pain. And the third point is that belief that normal activity should be avoided. So this seems to promote unnecessary long-term disability in non-specific lower back pain. So some of the treatment to change these negative, unhelpful thinking patterns may include cognitive behavioural therapy. So this has been shown to be effective in improving your pain intensity and coping with pain and changing pain behaviours compared with usual treatment. So CBT aims to challenge and modify the internal psychological processes, behaviour patterns, and negative thoughts often associated with persistent pain. So what's really exciting is that, as I've mentioned, we have our next webinar, which is on Thursday, the 27th of July. We have an expert guest speaker, which is Professor Louise Sharp. So she's going to go into all details about cognitive behavioural therapy and how it can help you. So make sure you tune in and register for that one. Then the other one is acceptance and commitment therapy, so ACT. So this aims to observe negative or painful emotions and thoughts with a different attitude involving diffusion and acceptance. So rather than control attempts and avoidance. So these concepts aim to assist people to accept and tolerate the pain rather than completely eradicating it. So this process can then open a person up to engaging in meaningful, values consistent living whilst being aware of your pain and carrying the distressing thoughts and feelings with them. So often engaging in more meaningful and value consistent activities. So this can help reduce psychological distress and reduce focus on the pain. ACT also aims to increase functioning and meaningful engagement in life rather than symptom reduction. So we'll go through some of the medications that may be prescribed to you by your GP or specialist to help manage your pain. So some of the most common ones are analgesics, which is your pain relievers. So like Panadol and osteopanadol. So they can reduce pain, but don't have effect on inflammation. So they act on the nervous system to reduce pain, but they don't affect other symptoms such as joint swelling or stiffness. So while paracetamol is one of the oldest forms of pain relief, current research indicates that on its own, it's not really that effective in treating lower back pain and provides minimal short-term benefit for people with hip or knee osteoarthritis. The second point is NSAIDs, which is your non-steroidal anti-inflammatory drugs, so such as ibuprofen. So they help reduce pain and inflammation. So it may be appropriate to offer oral NSAIDs for people with knee and or hip osteoarthritis, and it may be reasonable to trial them at the lowest effective dose for a short period, then discontinue use if not effective. So the third point is the topical pain relief. So these can include creams that are over the counter or prescription based. So we talked about I'm not going to pronounce it correctly, but the capsaicin one in the complementary medicines webinar. So this one has been shown to be effective in some cases for managing pain, as it disrupts that pain signal. But you can speak to your GP for more information about it. And it's also important to note that the Royal Australian College of General Practitioners does not recommend most other topical and complementary pain relief options due to limited evidence. And then the fourth point is, and this is a really good number to save, it's medicine line. So it's a free call number that you can ring 9 to 5, Monday to Friday, when you want more information on any of the prescription or over-the-counter and complementary medicines that you may take. So their number is 1300 633 424. So you can even Google online medicines line. It's just the government line, government website that has it on there. And it's I thought it was also important to note to always consult with your doctor or healthcare team to determine the most appropriate medications for your specific condition. So, other medications that may be prescribed to you by your GP or specialist are your DMARDs or your biologics, so your disease-modifying anti-rheumatic drugs. So methotrexate is an example of that one. So they're used to help control your immune system and slow down your disease progression if you have an inflammatory form of arthritis. The second one is your corticosteroids. So these are often known as steroids, and they're an anti-inflammatory medicine. So they're prescribed for a wide range of conditions, including arthritis, and they aid in reducing arthritis-related inflammation and can help alleviate arthritis pain. So steroids should not be used long-term to treat arthritis or any other conditions. They are sometimes used for a few weeks or months to boost the effectiveness of DMARDs or other drugs that you might be taking. And the third one is opioids, so your narcotics, and they may include codeine, fentanyl, tramadol, methadone. So they're used to treat moderate to severe pain when people don't respond well to other pain medications. So if not used properly, opioids can increase rather than decrease pain. So what we mean by this is that opioids do provide relief by blocking pain, but as a result, your body reacts by increasing the number of receptors to try to get the pain signal through again. So then over time, the same dosages may not be as effective. So some people may require larger dosages to get that same effect, but may run the risk of serious side effects and becoming more sensitive to pain. So it's really important to closely work with your healthcare team if you're taking any medications. So why opioids alone are not the answer? So research shows that opioids are not effective long-term. So they contribute on average to only a 30% reduction in pain. They also come with some really serious unwanted side effects, such as nausea, drowsiness, constipation, mood change, and difficulty in concentrating. After a short while, people may develop a tolerance to opioids, and the dosage must be progressively increased to achieve the same pain-relieving effect. High dosages and long-term use of opioids may lead to an increased pain experience, and this is referred to as opioid-induced hyperaglesia, so OIH. So this is defined as an increased sensitivity to feeling pain and an extreme response to pain. So this may occur when there is damage to the nerves or chemical changes to the nerve pathways involved in sensing pain. So this may be caused by tissue injury or inflammation, or by taking certain drugs such as opioids for chronic pain. Often the most effective ways to manage persistent pain is to not just rely on using medications alone, but also using multiple methods at once. There is not one method that will work just by itself, but collectively doing various things can help us manage our pain. And evidence shows that people with persistent pain who are actively involved in managing their pain on a daily basis have less disability than those who are engaged in passive therapies, such as just taking medications or having surgery. So pain medication is just one of 4 ways to manage pain. So other ways can include, which you can see on the picture here, is eat well, sleep well, and socialize. Psychological, which may help address anxiety or moods, and by using, CBT or ACT therapies. Physical activity, so exercise and remaining active, and then pharmaceuticals, so meds for pain and disease to be used as prescribed, and especially for those with inflammatory forms of arthritis. So now we're going to look at some other ways to reduce and manage pain and improve your quality of life. So we'll go into more detail of each of these sections in the next few slides. So the first one we'll talk about is increasing physical activity. So this helps keep our joints flexible and our muscles really strong. So physical activity has been extensively researched for pain management with osteoarthritis, and the evidence is really, really strong. So exercise examples may include, but are not limited to, walking, hydrotherapy, tai chi, dancing, strength-based exercises, and yoga. So a question we get asked a lot is how much exercise is recommended? And the answer is that it really, really depends on you, your physical fitness, and your pain levels. For specific exercises tailored to you and your condition, I definitely recommend speaking to a physiotherapist or an exercise physiologist. And you can get a chronic disease management plan from your GP to get these subsidised visits to these allied health professionals. And it's always worth having a chat to your doctor or specialist before starting an exercise routine. The next one that we're going to talk about is pacing and saving energy. So pacing yourself will help you have enough energy to complete an activity. So you'll recover faster if you work on tasks until you're tired rather than exhausted. So the alternative, doing something until you're exhausted or going for that really big push, means that you will need a lot longer to recover after you do it. So fatigue and stress on joints can exacerbate your pain and other symptoms. So it's really important to learn ways to conserve energy and minimize strain on your joints. So some activities that people pace doing are like housework stuff, so washing, vacuuming, dusting, or gardening. So just break up each activity and just do really little bits at a time and not all of it at once. So some of the top tips for pacing and saving energy include to break activities up into smaller tasks and spread them throughout the day, to try adjusting different parts of an activity to reduce the energy demand, as well as building rest into your activities. So they're key in recharging your energy. Stop, pause, and rest between activities where possible. And finally, look at the activities you normally do on a daily and weekly basis and develop a plan on how you can spread the activities out. So another good tip is to use assistive devices to help save energy as well. So the next one we're going to talk about is to quit smoking. And as we know, it's one of the main risk factors for arthritis. So research has shown that current smokers had more pain and were more likely to have cartilage loss and joint damage than non-smokers. So smoking also increases disease progression. It interferes with the metabolism of certain medications, and it's not good for your health or arthritis in general. So it's a huge risk factor for complications during or after surgery as well, because it causes that slower wound healing. The next one we'll talk about is relaxation, meditation, and distraction. So these all help to reduce muscle tension and stress. You can include the meditation, distraction techniques, or aromatherapy and controlled breathing in your day-to-day life. And some distraction techniques just means to shift or move your attention away from focusing on your pain. So some people find it really beneficial to paint, to read or listen to music, complete a puzzle or crossword, go for a walk or jump in the pool, just anything to take your mind away from the pain. The next point is physical therapies. So some people use hot or cold packs, as well as seeing a physiotherapist or an occupational therapist, and some even try acupuncture. So these allied health professionals, they can prescribe exercises or assistive devices and perform treatment to your affected areas to help with your pain caused by arthritis. So for people that don't know much about acupuncture, it aims to restore balance within your body, and it encourages it to heal by releasing natural pain relieving compounds. So these are called our endorphins. So some people find that acupuncture reduces the severity of their pain and enables them to maintain function. But just be mindful that there's studies on the effectiveness of acupuncture and the managing pain, and it can be a little bit inconclusive. So I guess it's just something for you to try and see if it works for you. So improve sleep patterns. So as we've already discussed sleep earlier, 80% of people with arthritis have reported that they do have difficulty sleeping. So whether that's trouble entering that dreamland or tossing and turning throughout the night or waking up various times during the night, this sleep deprivation can really make your pain worse and really have a negative impact on your overall health. So why does disrupted sleep affect our pain? So it can be found in our central nervous system, and studies show that the central nervous system pathways between the spinal cord and our brain that regulate pain may be abnormal in people who are not sleeping well. So a restful sleep often starts with good sleep hygiene, so avoiding those electronic devices, not having caffeine after a certain time, and having a strict bedtime schedule. And if you're able to sleep when you're tired and use pillows to support your joints during the night to make it more comfortable for you. The next one we'll talk about is increased social and support networks. So living with persistent pain can be really emotionally challenging, and having a support network can provide a source of comfort and understanding. So your friends, family, or even support groups can offer empathy, compassion, and a safe place for you to express your feelings and frustrations related to your pain. So some examples are to go and enjoy your social activities with friends or join social groups. And at Arthritis Queensland, we do have 3 different online support groups, as well as a peer mentoring one-on-one telephone service called Arthritis Assist. So it will just match you with a peer mentor or a volunteer that lives with arthritis just like you, and they can give you a phone call and have a chat about all things arthritis related. The next one is to find ways to help deal with the emotions. So the effects of persistent pain on mood and mental health are interconnected and can have a really significant impact on your well-being. So persistent pain can lead to emotional distress, feelings of sadness, frustration, and anxiety, and that irritability. And dealing with this pain can be really exhausting, both physically and mentally, and can contribute to some emotional challenges. So it's important to note that the relationship between pain and mental health is complex and can vary among individuals. So addressing the psychological impact of pain is crucial for a comprehensive pain management. So seek support from healthcare professionals, and these may include pain specialists, psychologists or therapists, and they can provide valuable strategies for coping with pain-related mood and mental health challenges. So employing techniques such as relaxation exercises or mindfulness, as well as counselling and that cognitive behavioural therapy as well. And these can help you develop effective coping mechanisms and improve your overall well-being. And the last 2 points, so the first one is effective medication management. So as we discussed, it's a crucial role in the treatment of your arthritis to help with pain, reduce inflammation, and improve overall joint function. But it's important to work closely with your rheumatologist or GP to determine the most appropriate medications for your type of arthritis. And they may consider factors such as the type it is, the disease activity, and if there are any potential drug interactions and any other health considerations. Medication management should be part of a comprehensive treatment plan. And as we discussed, it can include other lifestyle modifications, physical therapies, exercises, and other non-pharmacological approaches. And the last point is to work with your healthcare team so they can help you develop a pain management plan. And when you go see any health professional, it's really important to prepare for that appointment. So start by writing down some questions that you want to ask. Make sure you ask those questions in the appointment, and to clarify if you don't understand what their advice is or what they would like you to do. And write down the important information in your appointment, and then find out where you can get more information if you require it, and keep your healthcare team informed of any changes in your arthritis symptoms or medications or anything like that. So finally, some key messages. This is a lot of information and a lot of me talking, but pain is complex. It doesn't always equal harm. And remember to consider your DIMs. So those are your dangers in me. Challenge and change negative thoughts. So try meditation, mindfulness, cognitive behavioural therapies, or even distraction techniques. It's important to socialise and increase that sense of community and connectedness. Take your medications as prescribed and exercise as best as you can where you can. And that is it. So I am going to stop recording and then we can go through some questions as well.